Got crystals in your ear? Well, you came to the right place. My name is Amy. I'm a vestibular physical therapist, which means I treat dizziness, balance, and vertigo problems. First of all, if you are having vertigo, symptoms of turning, rolling, or spinning, please go to the doctor. It can be a number of things. It's not always BPPV. But BPPV, or crystals in the ear, is diagnosed by an ENT, an audiologist, or a vestibular physical therapist. Some primary care doctors do it, but many of them refer out to a specialist if they kind of pick up that you're having these symptoms. But benign paroxysmal positional vertigo is basically whenever you have debris that was supposed to be secure inside your ear, but it has broken free and now is tumbling around in your inner ear canals. Your inner ear's job is to tell your brain, balance area of your brain, if you're in motion or not. So if you now have debris tumbling around in one of your ears, it's going to give you signals that you're spinning in a circle, and your body is going to respond like you're spinning in a circle. So your balance is going to be really off. Your eyes are going to be spinning in a circle whenever you move your head, and it's not going to match what's really happening. So it's a really miserable condition to have. The way we diagnose this, believe it or not, doesn't even involve looking inside your ear, because the inner ear is deeper than we can see with our eyes. If we looked inside your ear, the first thing we would see is your eardrum. We wouldn't be able to see past that with the naked eye. And past that is where these inner ears canals live. It's encased inside bone. And in fact, they're so small that we can make out the outline of them in something like an MRI or an X-ray, but we can't actually see what's inside. And we would need to see that in order to diagnose. So instead we go by clinical signs and symptoms, which means we do stuff to you and then we watch what happens. So in order to test for crystals, first of all, let's orient ourselves. This is a right ear model. So it would sit something like this inside your skull, and the left would be like a mirror image. When we test you for this, we turn your head to one side and we lay you back quickly, and then we watch your eyes. When you're laying back, it's in a position something like this. And the debris, if there is debris in there, will start to move. When it moves, it hyperstimulates your motion sensor in that ear. It will make you feel like you're spinning. And your eyes will react in this spinning motion. Based on which way your eyes are moving, what direction they're spinning in, and what position your head is in, we are able to deduce if it's the right ear or the left ear that is afflicted, and which one of these three canals it's in, and that is how we actually select your treatment in order to get these guys to go back where they belong.